Hello, welcome to the Symposium of the International Society for Adolescent Psychiatry and Psychology, and abbreviation ISAPP. The title of our symposium is Current Issues and Challenges in Adolescent Psychiatry. Before starting the presentations, I would like to give you some information about ISAPP. My name is Fusun Çuhadaroğlu. I'm from Turkey. I'm one of the vice presidents of the association. So this is just the introduction of the people who are working on that. President Mario Speranza is from France. Véronique, who is also our president today, is the secretary of the association. Treasurer is Remy Barbe from France. Véronique is from Belgium. And immediate past president is Lois Polarity from United States. And currently we have three vice presidents. ISAPP is an organization established to work for the mental health of adolescents, and it is comprised of individual members devoted to working with adolescents in the field of childhood psychiatry and psychology, or adult psychiatry and psychology. And our missions are mainly to increase the collaboration among the professionals working with adolescents, to organize international congresses or workshops, to increase the mental health awareness of adolescents, and also increase the awareness about the mental health needs of the adolescents all over the world, which we believe is a subject which is neglected when considered under child and adolescent psychiatry heading. And when we think of the current issues and challenges of adolescent psychiatry, here we'll have a list. Transition nowadays is becoming more and more of an issue that we need to think of and need to develop new ways of management, because the adolescents who are having mental health problems are increasing in number all over the world, and they're also growing up. And after age 18, we need to transfer them to adult psychiatry. And the collaboration and the ways of doing these transitions may vary from the type, from disorder to disorder even, and there are studies going on this issue. Development and mental health needs of adolescents with autism spectrum disorder is another issue coming up as a concern now, because when we were thinking of autism spectrum disorders, we were usually talking about small kids, because autism is diagnosed at a very early age. But now those small kids are growing up, and many of them are already adolescents, and we need to consider how to manage their development and their mental health needs during the period of adolescence. Self-injurious behavior is increasing still and becoming more and more of a concern, like an epidemic among adolescents, and suicidal behavior as well. Along with the immigration issues all over the world, the problems, psychiatric problems of adolescents and their mental health needs is an important issue that we need to deal with. And like the pandemic we have this year, there are so many traumas going on everywhere in the world, and we need to increase the resilience of young people to get over with these traumas and traumatic periods during their lives. Cyber victimization is a serious concern, and screen dependency along with it. And personality disorder is another issue which is very attractive for researchers during the recent years, and mostly as a continuum of the identity confusion through borderline or narcissistic personality disorders. And gender dysphoria and related issues among adolescents is also, gaining a lot of popularity, and also a big challenge for the development and the management, and also management of these young people, and also how to help them to deal with their differences in their lives. I'm going to talk about what makes adolescents distinct regarding mental health. My presentation will follow this outline. And historically, adolescence as a term first appeared in the 15th century in theoretical considerations about nature of human development and used by the philosophers of the period at the time. And at the beginning of the 20th century, by the legislation for youth in the United States, it is named the age of adolescence, and first used as a name of a developmental stage by Stanley Hall in 1960. Hall described adolescence as a new birth. Higher and more completely human traits are now born. Adolescence is a phase of development in various fields. Biologically, from the neurobiological perspective, the pruning and myelinization starts by adolescence, and with that the brain tissue matures, and brain plasticity increases, and higher level mental abilities continue to mature. And we see maturation of thoughtful effort for control of behavior, enhanced reward seeking, exploration and risk taking, as well as enhanced flexibility in learning and adapting to new environments. Adolescence is considered as the last stage of intelligence development, is that IQ peaks in this period and then it starts to decline afterwards. And the gaining of perception of the time is very important, I think, which makes adolescence unique as well, because by gaining this perception, we as humans become aware of our mortality, and with being mortal beings is the most promoting, motivating reality of our lives. Adolescence is a very critical period for mental, social, and emotional well-being and development. Developmental changes in the brain lead to behavior patterns that will last into adulthood. And they engage in risky and thrill-seeking behaviors more than either younger children or adults. This is also something very specific, as you see here. Erikson stated that adolescence is both a period of opportunity for the resolution of unresolved developmental conflicts of childhood, and also a period where the precursors of the conflicts of the future stages of development are experienced. That is, adolescence has connections both with our past and our future, and this is a characteristic which no other developmental stage in human life has. Adolescence brings a lot of tasks as well, like body image development, development of sense of identity, emotional regulation, integration of self-image, enhancement of the self-esteem, separation and individuation from the family, and preparing for the adult roles, which also brings some challenges like coping with the changes which take place, biological, emotional, and social, and managing the exacerbation of earlier psychological conflicts, and also making vocational decisions and handling gender roles, bisexual confusion, sexuality, and pregnancy sometimes. Sexuality, love, and pregnancy is not a problem of childhood or adulthood, but it is for adolescents. And the data shows that several psychiatric problems or psychological issues come up in regard with these human issues. There are some environmental threats to adolescents' healthy, emotional, and physical development, like violence, unintentional injury, substance use, nutrition and obesity, digital media, and internet. Some of them are also some risk factors for children and adults, perhaps, but they consider to have the most impact in adolescence. Sense of identity is the major task in this period, which provides a basis for a sense of self-continuity over time and space, and related to the sense of self and personality formation, and is affected by psychosocial factors. So although the main development in adolescence has great impact on our personality in the future. And that's why we need to be very careful about the development and the problems in adolescence to prevent the future personality disorders as well. So there are some components of identity development, and if the sense of identity is not achieved by the end of adolescence, then the young person will be left in a psychic chaos, which is considered as the failure of gaining a sense of ego identity. And it is the key structure for personality organization for developing psychopathology, and it frequently forms the basis for the borderline personality disorder. Identity confusion is shown to be correlated with psychiatric symptoms and psychiatric disorders, as well as insecure attachment patterns. And early detection of identity confusion and intervention may be crucial for prevention of personality disorders in later life. Gender is another issue which is important again in adolescence, which is not so much a problem in children and adults most of the time. Gender issues arise in the frequency of psychiatric disorders, because as we all know, in childhood, most of the psychiatric disorders and psychological problems are seen more frequently in boys than girls. And in adolescence, this ratio reverses. So the girls become now more vulnerable to psychiatric problems. And gender dysphoria is another issue, though it may begin in childhood, but it's usually verbalized and being aware of in adolescence. And these young people need special support in this period. Social identity development, which is again another important task, is very much affiliated with the culture. And each culture and society recognize adolescence as a distinct stage. And for adolescence, we have so many terms to describe, while for childhood or adulthood, we don't use much terms. It's children or childhood or adulthood. But for people in this age group, we use adolescent, teenager, juvenile, youth, youngster, young person, emerging adulthood, and some of them are describing different age ranges actually. So it seems that there is also confusion in the people or in the research, in the minds of the researchers, which is not very clear about adolescence yet. So we need to work a lot for this group. I mean, regarding, you know, age issues, gender issues, and very many other things. And in societies, there are different methods demarcating adolescence from both childhood and adulthood. One of these demarcating issues is the initiation ceremonies, which is seen in many cultures. And it marks a transition from childhood to adulthood. And there is the visual markers of adolescence, that, I mean, that's the hair arrangement and their dress style change by adolescents, and also the accessories they wear. And now they are ready for new social roles. They're trying to adopt themselves. So societies recognize adolescence with these distinct changes as well. Mental health risks increase a lot in this period. There's an increased risk of death and disability due to reckless behavior and car accidents and mental illness. Social contact dissatisfaction and poor social support especially creates risks, especially for adolescents from rural areas, for youth from low-income households, and from child welfare and juvenile justice systems, and for minority groups. And mental health problems may lead school dropout in this period, and which is a severe consequence, which leads to a severe consequence in adulthood, affecting their lives, because they keep them from education. And the strained family relations also may be a consequence of mental health problems. Again, which means that they will be lacking the most important social support for their mental health and development. Again, the data shows that mental health problems in this period is associated with poorer education and employment outcomes in adulthood. We know that 1 in 4 to 5 youth in general population has a lifetime mental disorder, which is quite high. And 50% of adult mental health disorders begin by age 14, and 75% of adult mental health disorders by age 24. That means that if we become more aware of the problems, mental health problems of adolescents, and try to prevent or treat the disorders or the problems in this phase, that means we will be overcoming almost 75% of the adult psychiatric problems, which means a great input to all economies worldwide. Again, considering the psychiatric risks, 67,000 adolescents die each year from self-harm, and suicide is the 3rd leading cause of death in adolescents. Depression, again, seen more than 8% between 18 to 25-year-olds, and adolescents have at least one depressive period in their ratios, around 8%. And around 5% of them are left with severe impairment. And we know that 13.8% of high school students seriously considered attempting suicide. Non-suicidal self-injury is also rising up as a major public health problem among adolescents worldwide. And NSSI with suicidal behavior is contagious among adolescents. No other age group has these characteristics for mental illnesses or psychological problems, not in children nor in adolescents. nor in adulthood, but for adolescents, because they will, once they see a behavior in their friends, they will directly imitate it or share easily. Abuse and neglect is another important issue. Especially sexual abuse during adolescence was associated with abnormalities in late maturing prefrontal cortex, which obviously leads to the consequences of behavior problems, learning problems, attention deficits, and others, as you will know. We still have some diagnostic difficulties when working with this age group. There is the limitations of the categorical diagnostic systems. Though in DSM-5, it is tried to be compensate a little, but we still need a lot. And there's not enough number of valid assessment tools for various problems of this period. And cultural characteristic needs to be considered a lot when diagnosing and treating adolescents. And we also know that there are some unique presentations of some of the psychiatric disorders in adolescence, like depression, presents sometimes with conduct or behavioral symptoms, and anxiety disorders may present with symptoms like ADHD, hyperactivity, etc. Violent behavior may be a result of emotional regulation difficulty. And manic defenses of this developmental stage may appear in the form of a bipolar disorder, or may sometimes misdiagnosed as bipolar disorder. So there's a lot of diagnostic issues and difficulties for this period. For treatment, of course, we need the data again. But we know epidemiological studies usually covers children and adolescents together. And there is very little data showing only the subjects or the problems of adolescents. So we need data of situational analysis of this stage. Evidence-based data should be collected with a culturally relevant perspective. And specific biological characteristics like the increased metabolism rate should be considered, especially when using psychopharmacological treatment agents. And new interventions needs to be developed for the rising psychopathologies like nonsuicidal self-injury. Transition is another specific issue to adolescent age. Transition is a way to enable and support a young person to move towards and onto a new life stage. Needs to be coordinated, planned, efficient, and smooth as well. It's a dynamic process to be considered with a beginning, middle, and an end. And of course, there needs to be some policies and policy programs for adolescents. And distinct policy programs required for specific needs of this stage. Programs for children and adults don't usually cover the needs of this age group. And skills training, media literacy, and most risky issues should have priority in the policy programs regarding adolescents. And of course, we need to develop advocacy groups too. And that is why I am giving the speech now here. So in summary, as a young person, adolescent, being in the crossroad of childhood and adulthood, has unique developmental characteristics, has specific needs, has major challenges and psychosocial risks, suffer much more of psychiatric disorders, requires stage-specific diagnostic systems and assessment methods, needs treatment strategies based on culturally relevant evidence-based data, and deserves mental health policy programs which prioritize the needs of this stage. Thank you to all who are committed to working with adolescents. Today we have two speakers at our symposium. Professor Véronique Delvenne is from University Libre de Bruxelles, Belgium, and she's going to give a talk on psychiatry of transition in a world in transition. Thank you all for your attendance to our symposium, and now I would like to hand the position to Véronique to give his talk.
Thank you very much, Fusun. So I will present the work we are doing now with the support of, so I can't change the slides, so perhaps I will check the other one. It's a work that has been supported by King Baudouin Foundation, Julie Renson Fund, and Queen Fabiola Fund. It was a very large project on transition in a world of transition. So between 16 and 23 years old, there are great problems for transition from child and adolescent psychiatry to adult psychiatry. And we have made collaborative teams between CAMS and HAMS with Professor Marie Delay, Charles Cornreich, Hélène Nicolis, who are working in hospital, but also in ambulatory sectors. And we have two young PhD students, Dr. Simone Marchini, Dr. Joanna Hayes, and Dr. Anthony DeLeo. A lot of study have, and mainly the Milestone project also for Europe, said that there are specific needs for this population of youth that are not actually encountered. And this population is at high risk for mental health for different reasons. The adolescent-specific risk, also for youth with neurodevelopmental disorders, and also to recognize early or prodromal symptoms of adult psychopathology. There is a high risk of interaction of care at that time, and it's also related to a poor prognosis in psychopathology. So we have to need to increase collaboration between CAMS and HAMS, and also to plant movement from one to the other. You know that there are many psychiatric disorders that emerge during adolescence, mainly of the transformation of the gray matter density and also the synaptic density between 11 and 25. And you see that a lot of psychiatric disorder begin at the time of adolescence and also before. These particularities are linked to the delay of frontal cortex maturation. It's the large research of the NIMH on the maturation of brain. And if we see the adolescent brain, there are discordance between the hypoactivity of frontal cortical regions, which are at that time immature, and the hyperactivity of the amygdalian regions, which is implicated in emotion, stress, and conditioning. So there are a discrepancy between these two parts of the brain, which increase vulnerability at the time of adolescence. The objectives of the chair is a research project, also sharing knowledge activities with the population, introduce academic insights of transition needs, and also communication on social impact of that. I will summarize the research project. It's a large collaborative and cohesive project between SCAN and HAMS. The methodology is transversal and transdiagnostic. It's choose that the foundation support, and they prefer a dimensional approach than a categorical approach. The objective is to identify clinical dimension that contribute to the development of psychopathology during transition period. It explores continuity, resilience, or discontinuities during that period, and that request attention to care. And we have also to develop a non-stigmatization approach in order to reduce rejection of use in psychopathological suffering, and also to increase their social inclusion. We choose that new paradigms in psychiatry, and we are supported by one study that was published by CASPI in 2018 to 2018, that in HAP and child adolescent psychiatry, there are significant empirical evidence suggesting a single dimension that can measure a person's liability to mental disorders, comorbidity among various disorders, persistence of disorders over time, and severity of symptoms. We choose that dimensional approach. Two primary dimensions are important: the internalizing domain and the externalization domains, which is also supported by the CBCL, well known. And longitudinal research showed that poor childhood self-control reflecting emotional dysregulation and executive deficit. And a third dimension is the thought disorders, which is supported by an evolution into psychosis that could also account for a large majority of classical psychiatric diagnoses. Longitudinal research showed that poor childhood so it's the same, excuse me. Most mental disorders now consider as qualitatively different from normality, or in a continuum from normality to pathology. So we construct our research on the ERDOC framework within the 4 dimensions. So the ERDOC principles is to develop the framework to study psychopathology on dimension of observer behavior and neurobiology measures. So we use for the recruitment of the patient or the young people, it's not only patient, we choose 6 groups, one with neurodevelopmental disorders and early signs of psychosis, in patients with acute psychiatric disorders, outpatients with psychological distress, outpatients with addictive disorders, youth who are not in psychiatry but who are placed in service résidentiel pour jeunes, so it's a place where you have to live when your parents can't still live with you, and also a control group of young people in general populations. And we will evaluate this population with a dimensional approach. So it's a group of 300 youths, and we will have a re-evaluation 2 and 4 years later. We have a general database at Team 1 and Time 1, social demographic profile of the youth and their parents, detailed developmental and medical history, quality of life, incident of life events, family functioning, and interpersonal relationship and social adaptation. We will use some milestone instrument. We use the TRAM, Transition Readiness and Appropriateness Measure, to see what they need to transition. And we will also do a care need assessment with the ONOSCA at the beginning of the study. The psychopathology will be evaluated in a dimensional approach with the general psychopathology of Goldberg, the internalizing and externalizing symptoms with the use self-report, impulsivity and compulsivity with the BIS, depressivity and suicidal risk with the BDI, and emotional regulation axis, and also cognitive functioning with a brief WISE and executive function that will be evaluated at the beginning of the study. 2 and 4 years later, we will do a re-evaluation of all the use with a semi-structured interview. Psychiatric intervention or follow-up will be checked, past or present psychotropic treatment, and also emergency care and hospitalization during the 2 and 4 years. Quality of life will still be evaluated, and we will use the milestone suit instrument, which is the TRAM. And then we will assess the care need with the same ONOSCA. We add a therapeutic alliance questionnaire to see if the transition is good quality. A second point for the project is sharing knowledge activities, and we have to develop evidence-based approach and also new intervention models for the use. We developed improvement, we had to develop improvement or change in clinical practice and transmit preventive and treatment strategy to professional and family. So we have to construct plan movement from CAP to HAP. And we also have the objective to reduce stigmatization in the general population. The structure of the chair transition, there is a project coordination and management. I'm the coordinator. We have the collaborative team, but we have also collaborative partners, which are the different academic partners, the different clinical organizations. So we have done a group of collaborative partners that are meeting by video each 2 or 3 months, and we do also a meeting once a week with all the collaborators. There are also intersectoral partners on the judge, the child help, the handicap sectors, the school sectors, for example, and we use the new politics in Belgium to support that, because there are in each province a network that join all the child and adolescent partners, but also the intersectoral partners. And we also need to join the family and user of the target population, and we contact the Youth and Family Association, but also we have communication to media and internet. This is the governance structure. Here you see the intersectoral partners that I just speak about, in and out mental health care partners, in adult network, in a child and adolescent network, Also the Youth Welfare Service, Youth Court, Social Defense Unit, General Delegates of Children's Rights, cultural sectors and sport association and youth movements. We, for the third part of the chair, had academic insights. So it concerned the French community and Wallonie-Bruxelles Federation because there are another chair in the Flemish part of Belgium. The fund gives 2 chairs, one for Netherlands speaking and one for French speaking. So we join all the high schools and universities and also the clinical practitioner, general practitioner, pediatrician, adult and child psychiatry, and also through meetings of the scientific society. It's the first meeting that we have to postpone in September because of the COVID problems, but we have had 250 people who are following the meetings because we do it in presential and also by video. We have both program. So it was a great moment. It was the 4th of September, just between the 2 waves of COVID. And for concerning the social impact, we have communication with the partner of the different hospitals to communicate to the media about the importance of transitional care. This is an example of publication in the media. And I just want to thank all of you for your attention.